This is Dr. Lam, founder of drlam.com, and today we're going to talk about a common complaint among people with adrenal fatigue, which is constipation, for what appears to be no apparent reason. Now, there are many reasons for people to be constipated. You can have structural obstruction, you can have metabolic slowdown, you can have a diet that is insufficient in fiber, and many other reasons of the GI tract as well that can lead to constipation. If you have constipation and your doctor tells you that there's nothing wrong with you, then the question is, why would the body be in a state that is slowing down? Now, slowing down is the most common reason why people get constipation, and this happens frequently in adrenal fatigue. Let's see what happens. In adrenal fatigue, when your body is in the state of slowdown because it is so tired, it slows down the GI tract in order to conserve energy. Now, think about this. When the GI tract slows down, what happens to the food? The transit time, or the time that the food stays in the gut, from your mouth to the ultimate secretion as a bowel movement, will be lengthened. Now, when the body's ability to grind and absorb and break down the products from the food into smaller pieces becomes slowed, then pieces are not broken down as much. So as a result, when the gut slows down, the absorption slows down, everything slows down, and the body tends to be in a state of constipation. So this is very common in adrenal fatigue in advanced stages, especially when the body is trying to slow down to conserve energy. Now, all kinds of tests will show normal, and there's no way that the body or your doctor will be able to know what is going on. That's why it's called constipation of unknown causes. But is it really unknown cause? No. As you can see just now, we talked about the slowdown mode. Once you understand that the body is trying to slow down in this way to conserve energy, and as a result, the constipation becomes a symptom, then you realize that it is really a common physiological happening. So there are many things we need to talk about, but understanding this fundamental basis first is very important, because once you understand that, you will know that the solution rests with treating or dealing with the underlying root problem, which may rest in the adrenals and not necessarily at the gut itself. So if you try to just do things that will facilitate the bowel movement and not deal with the root cause of the constipation, you may feel better, especially if you do enemas, flushes, and with compounds that stimulate the gut to go. But these things may have long-term problems if the root problem remains untouched. So we see this frequently. And not only constipation, sometimes you can have associated diarrhea, and it fluctuates back and forth. So it's almost like you have an irritable type bout of symptoms. And this consistently has been a common picture that we see in adrenal fatigue. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I've written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.